We are ready.
Okay. Good evening, everyone, and welcome to the January 12, 2023 meeting of the Community Board 6 Health and Human Services Committee. My name is Elvie Barroso, and I'm the chair of the committee. This meeting is called to order at 6:32 p.m. Tonight, we are joined by Assistant District Manager Brendan Burt. As a reminder, New York State law now requires all community board members to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. If your camera is not on and your name not properly displayed, you cannot count towards quorum. Members of the public, you can raise any questions or comments that you have through the Q&A feature of Zoom. If there is time following the committee's discussion, we will field questions from the public. Aisha Siddiqui will take minutes tonight. Thank you so much, Aisha. You all should have received an email from the board office with a link to a Doodle sign-up sheet for minute takers at your committee meetings in 2023. For your convenience, the link to the sign-up sheet is being posted in the chat right now. We will now take attendance by roll call. Brendan will conduct the roll call.
Hey, members, when I call your name, you will unmute yourselves. When your name is called, please say present. I will announce if there is quorum. Marty Barrett.
Present.
Elvie Barroso.
Present.
Jason Fromowitz.
Present.
Sadie Howard is not able to join us tonight. Sandra left. Sandra left off.
Here.
Raj Nayar.
Present.
Aisha Siddiqui.
Present.
Hannah Singleman. Present. Ronnie is excused. And Kevin O'Keefe.
Present.
We have quorum.
Okay, good. The agenda for tonight's meeting was distributed ahead of time. Hold on. Hold on, Brendan. I don't know, my. I'm sorry, I lost my, okay. The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, you may raise your hand through Zoom. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the December 8th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, you may raise your hand through Zoom. Seeing no objections, the minutes from the December 8th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. First, no one may speak until granted the floor. Second, the committee members, if you have a question about committee business or wish to make a motion, please raise your hand through Zoom. Third, the chat function should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. When a committee member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Committee members are required by the state open meetings law to have their Zoom cameras on and your first and last name displayed during tonight's entire meeting, from call to order to adjournment. If you must step away from your computer briefly, you are required to leave your camera on. Tonight's agenda, the first one is about training on how to respond to an opioid overdose. Brendan, we have the speaker.
Hi, I'm Alex. I am conducting the training.
Okay.
Can I share my slides with y'all?
All right. Our speaker tonight is Ms. Alexandra Clark, who is an overdose prevention training coordinator from the Bureau of Alcohol and Drug Use Prevention, Care, and Treatment. So let's welcome Ms. Alexandra Clark.
Hi, y'all. Thank you so much for having us at your meeting tonight. Can y'all see my slides? One
Yeah.
sec. I actually want to stop and reshare just this screen. Great. So as was said, I'm Alex Clark. I'm the overdose prevention training coordinator at the New York City Department of Health in the overdose education and naloxone distribution unit. And I'm here with the director of the overdose education and naloxone distribution unit, Ian McHale, who's also on the call. I can wave. We're really excited and super grateful to y'all for making the time to do this training at your community board meeting. And really excited for y'all to participate in this effort. So first, I just want to acknowledge that this topic can bring up a lot of different emotions given the far-reaching impact of the overdose crisis. And the overdose crisis shines a grim light on structural racism and racial inequities that exist within our society. So the topics covered in today's training may draw up challenging or stigmatizing experiences that y'all have had in the past. And I just want to take a moment to acknowledge that and encourage everyone to take care of themselves before and after today's training. I guess it's not before, during and after today's training. And I also just want to say that during today's training, I will take questions at designated points, but if you have a question, I can see who has raised their hands, so I can also manage questions that way. Great, so today we will go over how overdose is affecting New Yorkers, briefly some data. We will develop an understanding of opioid overdose and naloxone. We'll go over the steps for responding to opioid overdose, and then we will discuss how y'all can access naloxone after this training. All right, so before we get started, I'm gonna go over some key terms. Just so everyone has an understanding of the terms that I'm going to be using throughout the training. The first term is opioids. So opioids are pain relievers, and these include opioid analgesics, which are painkillers, prescription painkillers, such as oxycodone, hydrocodone, Percocet, etc. So they're prescription painkillers, and opioids also refers to heroin and fentanyl. Fentanyl is a highly potent, fast-acting opioid that, and we'll discuss more about fentanyl later in the training. And finally, naloxone. So naloxone is a safe medication that can reverse the effects of opioids and prevent fatal overdose. And I hope you take a lot away from today's training, but the one key thing that I would like you to take away is that naloxone is an incredibly safe and effective medication for reversing opioid overdose. And when in doubt, if someone is experiencing an opioid overdose, you want to give them naloxone. Another name for naloxone is Narcan. So Narcan refers to the nasal spray formulation, and these I'm going to use interchangeably. So Narcan is the ping pong to naloxone's table tennis. It's just a brand name, but they're essentially referring to the same things. All right. Great. So before we go into what naloxone is, we're going to discuss how overdoses are affecting New Yorkers. Sorry, I'm just trying to get my screen so that it's not. Let's see, there we go. That's it. How overdoses are affecting New Yorkers. So I think this is a really important grounding for why this work is so important. Yeah, some of the data I'm going to present is 2020 data. Some of the data I'm going to present is 2021 data. So the 2021 data on the unintentional overdose deaths was just released today. I am going to share a link. I know the chat function is not for conducting business, but I'm just going to share a link in the chat for y'all to see. Let's see. The 2021 overdose data if you're interested in looking. So this is a graph from 2022 that shows the overdose deaths in New York City, or it's a graph from 2020, apologies, that shows the number of overdose deaths in New York City and the rate of overdose deaths or unintentional drug poisonings. And as we can see, this number increased from 2019 to 2020. And we also see from the 2021 data that this number increased again. So in 2021, there were 2,668 overdose deaths or unintentional drug poisoning deaths in New York City. This is an 80% increase since 2019 and a 25% increase since 2020. So unfortunately, we're seeing this number continue to rise. And for me, it's hard to conceptualize what 2,668 overdose deaths is. That's a hard number to wrap my head around. So what that means is during 2021, someone died of a drug overdose in New York City every 3 hours. So that's incredibly staggering. Yeah, it's a staggering figure. All right, so now we're back to looking at 2021 data, or 2020 data. Oh, God bless us all. So this figure shows the rates of overdose deaths by neighborhood of residents in 2020. If you look over here on the right or on the left, you can see the legend, which shows that the darker color indicates a higher rate of unintentional drug poisoning deaths. So the 5 neighborhoods with the highest rates of drug overdoses, fatal drug overdoses in 2020 are surrounded in yellow. So we see that there are 3 neighborhoods in the Bronx, 1 neighborhood in Manhattan, and 1 neighborhood in Staten Island. In 2021, all top 5 neighborhoods are in the Bronx. So some of the trends in this data from 2020 to 2021 are similar. We're seeing overdose deaths occurring across New York City, as you can see from this map. No area is not blue. Overdoses are occurring citywide, but we also see that where overdoses are disproportionately impacting communities that are impacted by systemic racism and systemic and structural racism, right? So communities where we're seeing systemic divestment in education, in housing, in employment opportunities are areas where we're also seeing the highest rates of overdose fatalities, and that rings true or remains true in 2021 as well. And the map for 2021 is in the link that I sent y'all. So in 2021, for the 6th year in a row, fentanyl is the most common substance involved in drug overdose deaths. So 80% of drug overdose deaths in 2021 involved fentanyl. So fentanyl is really one of the substances that is driving our overdose crisis in New York City. And when we refer to fentanyl, when I refer to fentanyl, I'm talking about non-pharmaceutical fentanyl in the New York City drug supply. So there is pharmaceutical fentanyl. It comes in the form of patches or lollipops, and it can be prescribed. But that is not what is really driving our overdose crisis. I'm talking about fentanyl that's being produced. It's 50 to 100 times more powerful than morphine and 30 to 50 times more powerful than heroin. And it's being mixed in prior to substances being sold at street level. So it's being found in heroin, cocaine, crack, counterfeit pills, ketamine, methamphetamine, and other drugs that are being bought on the street. And when I say counterfeit pills, I'm talking about pills that are being pressed to, it's like powder that's being pressed to look like, you know, a Xanax, but it might not be necessarily. So if it's not obtained from a pharmaceutical source, it's a counterfeit. It could be a counterfeit pill. And what it means that fentanyl is being found in all these different substances is that people who are not necessarily opioid users or naive opioid users are now at risk for opioid overdose. So this is a major, and people who primarily use cocaine and crack are at increased risk of opioid overdose. And then also, I just want to, flag when we're talking about fentanyl, we see a lot of stories in the news. People are really scared about this issue, and there's a lot of concern, a lot of information out there. So I just want to touch upon two myths that we hear a lot. The first is that there is no risk of overdose from touching fentanyl. And the second is that currently the New York City Department of Health has no evidence that fentanyl is being mixed in with cannabis at the street level. So what individual people are doing, we don't necessarily have information about, but prior to purchase, we don't have any evidence that fentanyl is being found in cannabis. So these are two things we hear about a lot. Great, so I'm gonna take a break to answer some questions. I will talk more specifically about the other things I haven't touched on in a minute, but are there any questions right now? Okay, I see one hand raised. Jason.
Yeah, so you mentioned that there's misconceptions about touching fentanyl and well, you mentioned that. Do you have any explanation for the like examples of that are shared on primarily, I guess, social media and or the media in general, where those are like instances of that being?
Yeah, so are you asking about times where I have heard that myth, or?
I guess, like, why is it? I have seen news reports from semi-credible places saying that, talking about individuals who are like overdosing from touching fentanyl, and I share this. I'm skeptical of these reports, but I guess I wonder like how they are. What is the motivation, and like what are they? I don't know.
Yeah, thank you so much for asking that question. I think it's a really interesting question, and my response would be twofold. The first is that this is a really scary issue, right? We saw the numbers about how many New Yorkers this is impacting. So this is a really big issue. And I think people, when there's fear, there is also a fertile ground for misinformation. So that's answer number one. I think answer number two is that there's a lot of stigma about substance use. And I'm going to talk about that and touch on that a little bit more. But, I think that it's not safe to disclose if you're using opioids, and it's not safe to talk about. And so people who might be using opioids don't disclose that they are, and then say that they are overdosing from touching fentanyl. So these are my two guesses. But yeah, I think the biggest thing, the most important thing for us, and the most important thing for this training is that if you respond to an opioid overdose, you are not at risk of experiencing an opioid overdose from responding. And I think that's our key takeaway. And then Aisha, I see that you have a question.
Hi, yeah, it's also about one of the myths.
Yeah.
If when you say it's not mixed fentanyl, there's no evidence that fentanyl is being mixed with cannabis. does that include like THC cards or just cannabis? And you know what I mean?
Yeah, I think it's a really great question. As of right now, we have no evidence that it's being mixed in with any cannabis product. So if it's being found, if people are reporting that they are experiencing an opioid overdose, it's possible that, you know, the individual blunt they were smoking or, you know, bong they were hitting had fentanyl, but on the broad level, it's not entering into the cannabis supply. Does that make sense?
Yeah. Thank you.
Great, excellent. And then Kevin.
Kevin? Kevin, you have a question?
Okay, so you don't have a question.
I do.
Okay.
Sorry, I was talking to somebody here in a family conversation that not everybody needs to hear. Yes, and I had to step away for a second, so I apologize if you've already addressed this. But do you have any data breakdown of teenage overdose in terms of possibly percentage of the full New York population?
Yeah, this is a really interesting question. We do have some data on age. I don't know specifically if there's data on teens, but we have data on age, and I can follow up after this with that data. So thank you so much for asking that.
Right. Do we know, I mean, do we have anything ballpark as far as teenage or school-aged usage to the degree of, you know, the level of overdose?
Yeah, it's a good question. And off the
Is it
top of my head,
increased?
off
Has
the
it
head, yeah, I don't have any data. So our data primarily comes from mortality data. So we do not keep track of data on use. Like the Department of Health doesn't keep track of data on use. So that data we don't have. And I can follow up about mortality data. I don't know it off the top of my head, unfortunately, but I think it's a really good question and it's an important question.
Thank you for the follow-up.
Yeah. Okay, I'm going to keep going because we got some material to cover, but we'll definitely have other times to break for questions. So thank you all so much for those questions. Great. So now we're going to talk about understanding opioid overdose specifically. So how do opioids work? So opioids, as we talked about, are different kinds of substances that when ingested attach to opioid receptors in the brain. So in this image, the opioids are the purple and the opioid receptors are the gray squiggly lines. And when they attach to the opioid receptors in the brain, they can have a myriad of effects. They can, you know, a handful of effects, some of which are desirable. They can relieve pain, they can relieve withdrawal, they can produce feelings of happiness and comfort. They also have some side effects, which are constipation, nausea, drowsiness, and respiratory depression. So when someone experiences an opioid overdose, it's because they have consumed a quantity or strength of opioids that gradually suppresses the involuntary drive to breathe. So the opioids are sitting on the opioid receptors in their brain, and their involuntary drive to breathe. So every day we breathe and we don't think about it. This involuntary drive, this just sort of natural process that happens, slows down. Eventually, because breathing slows, the amount of oxygen that is being circulated to major organs in the body, such as the heart and the brain, decreases, and these organs stop functioning. And this can lead to, unconsciousness, coma, and eventually death. And when someone survives from an overdose, so there's overdose and then there's fatal overdose. And when someone survives an opioid overdose, it's because someone was there to respond. So it's very rare that someone dies immediately from an overdose. And when people survive, like I said, it's because someone was there to respond. Fentanyl is more fast acting than other opioids. So the window to respond, the time is not as great, but there's still time. So now we're going to talk about naloxone. So what is naloxone? Naloxone's only function is to reverse opioid overdose. It's a safe medication and there is a zero effect if opioids aren't present. So as I said before, when in doubt, administer the naloxone. If you are encountering someone who you think is experiencing an opioid overdose, it's important to it's better to err on the side of administering naloxone than not administering because it has no negative effects. It's available in an intramuscular injection and a nasal spray. Today, we're only going to focus on the nasal spray. Like I said, there are no negative effects other than that it may put an opioid dependent person in withdrawal, which is uncomfortable. There is no potential for misuse or dependence, and responders in New York State have liability protections. So how does naloxone work? So as we saw before, opioids sitting on the opioid receptors in the brain, naloxone enters the body, and it bumps the opioid receptors, the opioids off the opioid receptors. This process usually takes effect within 2 to 8 minutes. So it takes 2 to 8 minutes for someone's drive to breathe to be restored after administering naloxone, and naloxone lasts in the body for 30 to 90 minutes. So the opioids that were not already consumed, metabolized by the opioid receptors, hang around in the body and will reattach to the opioid receptors, and someone who's opioid dependent will get relief from their withdrawal. But if someone were to ingest more opioids when naloxone is present, the opioids will have no effect. All right, so now we're going to discuss how to respond, the specific steps for responding to an opioid overdose. And before I do, I just want to, like I acknowledged before, substance use, drug use is incredibly stigmatized in our society. It has been criminalized for decades, which has only exacerbated our current opioid overdose epidemic. And so I just think when we talk about these things, when we talk about substance use, it's really important that we acknowledge the humanity of people who use drugs. There's a lot of stigmatizing language in our society around people who use drugs, right? Like we've all heard it, we've all used them, we've heard people referred to as addicts or abusers or junkies, right? And these are not the most compassionate terms. And so I think when we think about how we can be an effective advocate for this community and really effective responder in this crisis, and potentially to engage folks who are using substances, we really get to think about the language we use and people-centered language first. And I will circulate, if y'all want to send me a list of folks who were on this meeting, I can follow up with some resources, including the slide deck, and I'll send a longer slide deck which contains some alternative words that are just more human-centered. So when responding to an opioid overdose, the first thing we need to do is look for the signs of opioid overdose. So these are going to be the signs of respiratory depression: slow or stopped breathing. The person will be unconscious or unresponsive. They'll have blue, gray, or white lips or nails. They will be snoring or gurgling, and they may have muscle stiffness or rigidity if they've consumed fentanyl. So the first thing we want to do is look for those signs. And if we see someone who we believe is exhibiting those signs, we want to check for responsiveness. So there are 2 ways we do this. The first is to shout at them from a distance. So if you come into a room and you see someone who you believe is experiencing an overdose, and you know their name, you can shout their name. If you see someone on the street, you want to say, "Hey, I'm going to call 911," or "Hey, are you okay?" You want to get them to respond. The next thing we can do to check for responsiveness is a sternal rub. So I like to, I'll demonstrate. If y'all want to do this wherever you are, you can. You don't, that's okay. So what a sternal rub is you're going to take your fist, and it's being shown here in the image, and you would take your fist and rub it up and down along that person's sternum, grinding it into their breastbone. And if you're doing this with me right now, you can tell, oop, that's pretty uncomfortable. And the hope is to cause this person to become responsive. So it's uncomfortable, it's not painful or harmful in any way. We just really want to make sure that this person is not conscious or responsive before we administer naloxone. And the reason we want to do that is because naloxone can put an opioid dependent person into withdrawal, and that might not be necessary, right? If someone's high but not yet overdosing, you can stay with them, or you can take them to the emergency room or call 911. But you don't necessarily have to administer naloxone unless they are not conscious. So if the person has no response to the sternal rub or the to the sternal rub or the shouting, we want to call 911 for medical help. We really encourage folks to call 911. And when you call 911, you want to give the dispatcher the address and the specific location of where you're at. You want to tell them what you see. So I'm not a medical professional. I would not say I'm with someone who's experiencing an opioid overdose, because I don't know that for sure. They could be having some other medical event. So what I would say is I'm with someone who is not conscious, they're turning blue, and they're not breathing. So I would tell them what I see. And there are a handful of reasons we encourage folks to call 911. This, like I said, may not be an overdose. There could be potential medical complications from the overdose, and more doses of naloxone will be needed. So we'll talk about how many doses of naloxone come in a rescue kit in a moment. But there may be more needed to reverse this specific overdose. In New York City, in New York State, actually, there are protections for the overdose victim and those who call 911 from prosecution. This is called the 911 Good Samaritan Law, and it protects folks from prosecution for drugs up to A2 felony offenses, for alcohol, cannabis, paraphernalia offenses, sharing of drugs. It does not provide explicit legal protections for probation or parole violations, violations for open warrants, or issues related to immigration or child welfare. So this is, the state's way of encouraging folks to call 911. So if you have, you checked for responsiveness by shouting and doing a sternal rub, it's time and call 911 if that's in your overdose response plan, although we understand why some folks might not want to call 911. It's time to give naloxone. So every kit comes with 2 doses of naloxone, 2 doses of Narcan. It looks like this. It's in a little blister pack. And so the 3 steps, super simple: peel, place, and press. So the first thing you're going to want to do is peel open the blister pack. Then, let me get my little trainer device. I forgot to take it out. Then after you peel it open, you're going to want to take out the device and put your 2 piece fingers around the nozzle and place your thumb on the side. And the reason I place my thumb on the side is because I don't want to accidentally press down on the plunger until I've placed the device in the person's nose. So as it says, all of the medication releases at once. It actually doesn't say that anywhere on the slides, which is interesting, but all the medication releases at once. So we want to make sure the device is placed in the person's nose, that my fingers are touching the bottom of the person's nostrils. And then finally, you want to press down on the plunger, and then you want to wait. You want to wait 2 minutes to see if the person becomes responsive. And 2 minutes could potentially be a really long time to wait when you're with someone who's not breathing. So we encourage folks to wait for 2 minutes, or that's the guidance. And, everyone is doing their best. An overdose situation is a really intense situation. So then after 2 minutes, if the person is still not responsive, you want to repeat the same steps: peel, place, and press, using the other nostril. So you peel back to the device, you place the device so that your fingers are touching the person's nostril, and then you press down on the plunger, releasing all of the medication. All right. So if the person becomes responsive, they might be confused or afraid, and you can explain to them that they overdosed. They might be in withdrawal, and it's important to reassure them that naloxone wears off in 30 to 90 minutes. It's also important to communicate to them that using more drugs during this time is unlikely to reduce withdrawal, but may increase risk for another overdose. And finally, if you haven't called 911 already, you can discuss the benefits of receiving follow-up medical care. And if the person declines medical attention, it's important that someone stays with them for at least 3 hours. And if you haven't called 911, this is a good opportunity to give some agency back to the person who you're responding to, and see if they want 911 to be called. Then there are 2 other ways to support someone who is experiencing an overdose. The first is rescue breaths. So every kit comes with a face shield, looks like this. It has writing that goes from left to right. That's how you know which side is right side up. It has a one-way filter. So what you would do is, if the person is lying on their back, you want to tilt their head back put the face shield over their face, and then it's shown right here, pinch their nose, and you want to give 2 regular sized breaths into the filter. If their chest rises, that's great. And you want to give 1 breath every 5 seconds. If their chest does not rise, you want to adjust their head so that their airway is open, and try again. This is a great way to support someone who's not breathing. Another way is to put someone in the recovery position. So this is leg to the side, arm to the side, and head on their arm. So rolling the person onto their side so that they can't roll over onto their stomach or roll over onto their back. All right, so now we're going to talk about naloxone access, but before we do, I just want to pause for any questions. And I am aware of the time, because I know y'all have other business to be conducted in this meeting, but I just want to stop here to answer any questions before we talk about how y'all can access naloxone. Okay, Martin.
I looked through the update that you put in the chat, and basically it says that Black women between the ages of 54 and 65 are the main group of individuals who overdose or who die from the overdose. What outreach is the department doing in the areas that you get this data from?
Yeah, this is a great question. So the department is doing a handful of things to combat this crisis. We have overdose prevention centers in several neighborhoods that are at high risk of opioid overdose that we don't run, but we do fund. We have syringe service programs where people can go to get safe needles, clean needles. We have Our unit is working to expand naloxone access throughout the city to distribute kits and make sure that everyone in the city has access to a kit. I know Ian is on the call. Ian, let me know if you have any additional things that you would like to highlight that the Bureau is doing.
Yeah, thanks. So I think in addition to that, the other big program that our Bureau does is the Relay program. So it's a 24/7 peer-led non-fatal overdose response system where wellness advocates are deployed to emergency departments after somebody has experienced a non-fatal overdose. During this time, they get to provide them with a naloxone kit and other resources to be able to assist them with aftercare and follow-up. And in addition, if you have any other additional questions or would like more information, we can follow up as well with more resources that our Bureau is providing and how we're able to respond to the 2021 data that we now have.
It'd be great if you could tell us what's available in the CB6 area.
Great, we can definitely follow up with that.
Great.
Some information about that after this meeting about specific to CB6. And I really appreciate that question. I appreciate you looking at the data. Okay, Jason.
I'm also trained in CPR. How would you distinguish between somebody needing naloxone versus like a cardiac arrest or other reason that they are unconscious or unresponsive?
Yeah, that's a really excellent question. And I apologize for not mentioning it on the previous slide. We do encourage folks who are trained in CPR to follow their CPR training. I think, our message is when in doubt, administer the naloxone. So yes, you could additionally support someone with your CPR training. I'm not CPR trained, so I would never do that. I would support someone with rescue breathing. But, if you're seeing someone and you think they're having, if you think from what you've learned today and the information we'll give you after that they're experiencing an opioid overdose, I would administer the naloxone.
Thanks.
Yeah, thank you so much for asking. All right, I'm gonna keep it pushing to be mindful of the time, but I also just wanna say any additional questions, I will put my email in the chat so y'all can follow up with me via email. Okay, So accessing naloxone. So you can request a kit be mailed, a naloxone kit be mailed to you by going to nextdistro.org/NYC naloxone, and I will place that link in the chat. You can also scan the QR code, and that will send you directly to that link, and the kit will be mailed to you within 5 to 7, within 10 business days. That's what we say. If you need access to a kit sooner than that, please visit nyc.gov/naloxone, and we support opioid overdose prevention programs throughout the city, which are community-based organizations that can help you access naloxone. What is an overdose rescue kit? So when you request your kit, you'll receive a blue bag that looks like this. It comes with 2 doses of Narcan, a face shield, 2 non-latex gloves, educational materials like this, a blue certificate of completion, and a Narcan instruction sheet. So what we encourage everyone to do is review the educational materials when you receive your kit, because it goes over everything we've covered today with more detail and beautiful, not more detail, I guess it's technically less detail, but in beautiful detail and with pictures, which is really nice. Once you receive your kit, you want to add your name and the date to the blue certificate of completion that looks like this. And then you want to keep your blue card inside of your kit. And like I said, you want to review the instructional insert in the kits to go over the response steps. And after you use naloxone, we encourage you to submit an anonymous report as soon as possible by emailing naloxone@health.nyc.gov. That email is also on the back of the blue card you'll receive if you order a kit from us, from that link I posted. And we encourage everyone to get a refill if you use 1 or more doses of naloxone, if your kit is lost, damaged, or stolen, or if your naloxone is expired or near expiration. So all kits have an expiration date on the back, as shown in this figure here. And we always want folks to have 2 doses in their kit. So if you use 1 dose and that is effective for reversing the opioid overdose, we encourage you to get another kit. Okay, so we covered a ton of information today, went over some data. We talked about what opioids do, how to recognize the signs of an opioid overdose, what naloxone is, how to use naloxone, and how y'all can get naloxone after this training, and also some other ways to support folks who are experiencing an overdose. So that's all the information we have for you. And I'm happy to answer questions and also understand if you need to keep your meeting moving. So I'll put my email in the chat.
Yes, thank you. Thank you so much, Alexandra. That was a comprehensive training for us. And thank you also for Ian. So you're going to hear back from us.
Great. Thank you so much.
Thank you.
Okay.
Okay, so we're now going forward to the second agenda, which is a discussion of the unlicensed smoke shops in Manhattan Community District 6. So John is here in our meeting. John is the chair of Youth and Education Committee, and I'm not sure if Claire has hopped on already, who is the chair of Business Affairs. And thank you for coming to our meeting tonight. We just want to know where we are in the issue of these illegal shops selling cannabis.
Yeah, thank you very much. I'll take as little time as possible of your time. Basically, I reported last night at full board on where things stand. And just to recap, in case anyone was unable to be there, the main impetus on this right now is in the state legislature. And as one hangs around the community board for a few years, one learns something new every few months. And I've learned there's something called a bill being on the second floor in Albany. which means that it's with the governor. As many of you know, Senator Krueger presented a bill last May. I think it was S9475 in my notes somewhere. I have that. Basically, stiffening the regulations on smoke shops and other distribution and legal and illegal distribution of cannabis. And the Senate passed it, and then it went to the Assembly, and the Assembly wanted to have more discussion on it. There has been, according to the report last night from Senator Krueger's office, consensus between the Assembly and the Senate and the governor. And no one has seen the final bill yet, but it will be put forth fairly soon by the governor with her support. So apparently there are bills that can originate with the governor. I was not aware of that until this event. So that's happening. And so where we are as a committee right now is the lead is being taken on this by Claire and the Business Affairs and Licensing. I'm kind of shepherding it through because I have a couple decades of experience on this issue and familiar with some of the players. But ultimately, this will reside with Business Affairs and Licensing. We're going to head towards a resolution for the full board, hopefully to be presented in the February meeting. But it seems like we're wasting people's time if we present a resolution and before we see the legislation that comes out. So we're going to wait. Our two committees, Health and Education and Youth and Business Affairs and Licensing, meet in the last week of January, and we'll come back to you and hopefully we can get either a meeting at the full board meeting or some other way to get your committee to come on board with the reso once it's developed. The other piece of information that was I presented last night was that the New York City Council, 3 committees of the New York City Council, and I named them all last night. And if anyone is interested, the meeting is on this Wednesday at 10 a.m. at City Hall, and there'll be a public hearing. And the hearing will be a joint presentation of the Committee on Health, the Committee on Oversight and Investigations, and the Committee on Consumer and Worker Protection. The Committee on Health is chaired by Lynn Schulman. The Committee on Oversight and Investigations is chaired by our friend Gail Brewer. And the Committee on Consumer and Worker Protections is chaired by Council Member Velasquez. So those 3 committees, I'm going to submit written testimony and try to get down there. And I would urge all members of the board who are interested in this to be heard one way or the other at that meeting. The main focus, according to Senator Krueger's office, of the City Council and the city right now, and I've been given contacts in the Office of Consumer and Worker Protection and by Senator Krueger's office, as well as at the OCM. The main focus of the city right now is that they're going to want to put regulations whereby landlords have to be informed if a smoke shop renting from them has been cited. And there will be other things coming out, I'm sure, at the meeting on Wednesday. I'm going to stop there because you're coming up on an hour and just take any questions. But that's pretty much where things stand. We're heading towards a resolution for the February meeting, and ultimately, and that will be passed by Health and Youth and Education and Business Affairs and Licensing at the end of this month, and be brought back to your committee, hopefully before the full board in February. So I will just stop there. I will just make the aside comment here that this is an issue that has gained incredible momentum in the district and across the city, and I really haven't seen an issue other than on schools at certain times where I've been very involved, that has gained so much momentum. And I put it to people that it's a sort of a political perfect storm that we have. You need 2 things for a political issue to move forward. One is, you need a wedge issue, and legalization, I support it. Many people don't, is a wedge issue. And you need a core constituency to move forward with it. And as I politely or impolitely put it, one thing that one constituency that will move anything forward is a bunch of, I use another term for this, but mad parents. You can imagine the term I used for it otherwise. But we have both things going on this. So I'll stop now and take questions. But actually, I'll yield the floor back to the chair, to Chair Barroso.
Thank you so much, John, for the update. So do we have questions for our members?
I see Jason has a question.
Jason.
Yeah, thanks. In terms of the legislation that's being proposed around this, is there anything around the marketing and the advertising of the cannabis products that these shops are doing?
That's a very good question. I haven't looked at Senator Kruger's original bill, but I'm pretty certain that she addressed it in that bill. And I know it's on the table. So, you know, and comparisons are made to Joe Camel, and I have arguments with friends of mine who are deeply advocated for legalization, who say that's not a fair comparison. I say, well, I think it is. So we have a discussion at that point. But yes, the advertising, in fact, there was a parent who told me the other day that there was a shop in Lower Manhattan, I believe, in Battery Park, that was actually luring kids in with brownies, laced with THC. So, I mean, this is a very volatile issue at this point. So that's a good question, Jason.
Thanks.
Any other hand?
I actually have my hand raised. Not so much a question as much as just a point of scheduling clarification, which is that the next meeting of the Health and Human Services Committee is scheduled for Thursday, February 9th, which is the day after February's full board meeting. So given that little scheduling note, I don't know how that affects things, John, since I know the aim is to have something ready for February's full board, but I just wanted to make that note.
Elvie, may I address that?
Yeah, so John,
Okay. Yeah, what I was thinking of doing, when we used to meet in person, we would just caucus at the full board. And I believe in the last couple of years, and during COVID, there have been cases where a committee would meet right before full board to discuss an issue. What I would urge members of this committee and others on the board to do to attend the Health and Education meeting in the last week of January and the Business Affairs and Licensing Committee in the last week of January, where if they want to be heard more robustly than that setting would allow, they could be heard. That would be my thinking on the process. Otherwise, we push into February. Of course, if the governor hasn't pushed this legislation out by then I would actually propose a very brief whereas with several whereases and would therefore be a resolve. We'd really like to know when it's coming, but hopefully we won't have to do that.
Or you can also send me a draft of the reso.
Oh, sure. No, I want you to be involved in the discussion. Oh, yeah. I mean, I want you to be involved in it, and your committee members to be involved. It just seemed premature. It just seemed premature to put a reso together until we saw what the governor and the assembly and the legislature have agreed on. And we, and people have enough things to do. And also we're very interested in where the city council is going to go this week.
Yes, that's right.
But just to clarify, this is with the Office of Consumer and Worker Protection at the city level. And the OCM independently reports now directly to the governor. It was originally going to be part of the SLA, which makes it the State Liquor Authority, which makes it quite logically part of centered in Claire's committee, and Claire and I are in close contact as are LB and I on this.
Yes. And we have one member that is interested in participating in the writing of the RESO.
Yay,
Isn't it?
that's very welcome. Could you put me in touch with that person?
Yeah,
you know,
we
that'd
will, we will do it. Okay, thank you
Okay.
so much, John.
You're welcome. And it's 7:26, so I'll be quiet.
And I don't see Claire, so probably we will try to attend in their meeting if it's being discussed.
Yeah, I think the three of us, LV, you and I, LV, Claire and I, we should, once I have something pulled together, I'd like to review it with you before I even take it to my committee. So,
Yes,
and then you can bring it to your committees.
yes, definitely. All right, thank you so much, John. Any other question for John? Okay, so we're gonna go to next one. Okay, I have a short report. I just want to let you know that we have a new date for our health fair, which is June 10th, not June 17, because according to the CB6 office, June 17 is too close to the date of the June 10th celebration. So we're gonna push for June 10. And Jason had developed already the flyer. It was an excellent one. So Jason will just update the date of the health fair. Also, we have identified a venue for the health fair. It's at the Epiphany Parish Hall at 22nd and 2nd Avenue. So I spoke to the parish priest and I learned that the regular price to rent the hall is $2,000. But, you know, I asked for a discount. So since the health fair is for the benefit of our community, they will only charge us $500. So Jesus, Brandon, and I are going to see the site. We're going to do a site visit next Wednesday and decide whether we will take it or not. But keep in mind that we won't be able to find a place anymore as cheap as this. So I hope to get it. Now, I just want to ask, any updates on speaking to prospective vendors?
I missed last week's meeting, but are there any left that are to be assigned to call out? I'd be happy to take some on to contact some.
Did we take that, Brandon, a list of those that volunteered? The first 10 was, I think the first 10 was Marty. Everyone, is it not Brandon?
Yeah, I would need to look back at that list to see exactly what the ordering was.
Okay, so yeah, if you can start calling some of those vendors on the list, and since we have a date already, June 10, and we just need to finalize probably next week the site or the location of the health fair.
If you
And
send the list,
yeah, so Brandon will send the list. Marty, you have other question?
No.
Okay, so Brandon will send the list, and if you see on the list anything that is familiar to you or you have in contact or in communication with those vendors, please, let's move faster because time flies. It's already the last week of January and we need to formalize. Oh, by the way, I just want to mention that according to Brandon, we don't need an official letter to request them. Isn't that, Brandon? Is that right?
No, I think just a simple email or phone call is sufficient.
Yeah. Yes. Okay, any other questions? So any other old or new business?
I got something quickly on the venue selection. Something that I was, or if I may.
Sure.
Thank you. Something I was thinking about was, would we want to consider potentially doing an outdoor venue, either like in a park or on a closed street? For two reasons, maybe three. I suppose we could do that possibly for free or close to free. Second, it may alleviate some COVID concerns for some populations that might be hesitant to come to an indoor location, depending on where we are at that time. And third, we might be able to attract more like foot traffic and just like passerbyers if we're outside. I so appreciate though that like then weather becomes potentially an issue.
Yeah, so that's June. So hopefully the weather is going to be good. But do you have anything in mind about having it outside?
I was sort of thinking about like, could we do it on like request a closure on Irving Place, and then we might be able to take advantage of first of all, it's like a low traffic street. Second of all, we might be able to take advantage of like foot traffic to the farmers market, which is also Saturdays. It was an idea I had.
Well, the problem with outside is that first you have to think about how are we going to support the vendors. We should have a table for all the vendors. Where are you going to get that? That means that we have to hire somebody to provide us those tables. That's another cost.
Yep.
And if you know the cost, that the money that we paid for the last one at Baruch, do you remember, Brendan? That was.
I honestly, I don't remember what that cost at the time. Jesus might know.
Yeah.
Since he was the primary one who dealt with Baruch itself.
But I think that was over 1,000. It's not cheap to rent a space, okay? But doing it outside, you have to think about those. We do not have control of who's gonna be coming to those vendors, you know, because if it's outside, everyone can just come. Then you have to think about the tables. Who's gonna provide those? We have to rent tables. It's a lot more to think about if you're doing it outside.
The other thing I'll say, just to interject, I mean, one thing to think about with an outside location is, you know, I know you alluded to it, Jason, but the weather. When we held the Senior Resource Fair back in 2019, half of the event, there were thunderstorms outside.
It was raining.
So there would need to be also some sort of indoor contingency plan or some sort of contingency plan if that were to happen here.
Yes. And you cannot make a contingency plan if you don't rent a place ahead of time.
Well, although I wonder, maybe could we potentially do somewhat of a hybrid of that then? Like, could we potentially utilize the like setup and the tables from the church and move inside if necessary? No.
No. I don't think that's possible.
I see Kevin's hand is raised.
Yeah, I've done many events at that venue. My kids go to school there. That's exactly what they do. They have an outdoor event on that stretch between 2nd and 3rd on 22nd Street. And if it rains, they put everything inside. So that has been done. They do it for their spring festival, and they've done it for their walkathon. That's how they do it.
Any other hand?
I see Sandra's hand is raised.
Yeah, yeah. Well, I was just gonna say, if you wanted to do it outside, there's also the schoolyard right across from Epiphany, right on 2nd and 22nd. That's
They
You know-
use, for their events, sorry, could I have the floor?
Sure.
Madam Chair? Okay, I'll take it. That's exactly what they do. So for example, for their spring festival, they do all their food, barbecuing and all in the schoolyard, and then they use a street for games and other vendors. Works out nicely.
We'll explore on that. Any other question? Any new or old business? Okay, so if there's no other committee, old or new business, we're going to adjourn the meeting. So seeing no further business, the meeting is adjourned at 7:37. And thank you so much, everyone, for